So we have 4 technologies, and 2 of them are cell therapy products. One where we are creating autologous dendritic cell vaccine for cancer patients. Sarcoma is going to be our first clinical trial with this technology. Our another technology is tolerogenic dendritic cells, where we are going to target autoimmune disorders. Aplastic anemia and graft versus host disease are going to be our first clinical trial. So these 2 products are our cell therapy products.
The cellular therapeutic approach, it takes quite a long time and much effort, but it's worth it. More effective, more safer, more durable effect if we want, and we have to go with this technology.
We take advantage of big data, artificial intelligence to identify specific genes which are notorious and specific to that patient's specific cancer. We have this strong immune system which is supposed to take care of any disorder or any indiscipline which is happening in our bodies. Somehow, when cells become notorious, they become cancerous or they turn into any other disease, they somehow find a mechanism to escape the immune system. So technology is what we developed there, where we have identified that how these cells are escaping from immune system. So maybe we can genetically modify or target chemically these cells due to which they are escaping from our immune system. Or we can actually redesign our immune system. We can coach them again so that immune system can go back and take care of the diseases. So once you identify and decode that by big computer algorithms, then we can prepare these antigens outside the body and take out that patient's immune cell, coach them, show them these antigens, and put it back into system.
This is a form of therapy that's very personalized. A patient's own immune cells are taken out of their body, genetically modified so that they can recognize the patient's cancer, expanded in the laboratory, and then they're infused back into the patient much like a blood transfusion.
We are generating this dendritic cell out of blood, and then we further differentiate this dendritic cell as a mature form. And then we can just add tumor-specific antigens on surface of these antigen-presenting cells. And then if we give back to the patient, then this dendritic cell eventually activate T cells that are reactive to these specific antigens. That's how we are expecting, and then they are clinically proved method. We are developing the more efficient way to stimulate these T cells.
We're not giving the patient something foreign. We're not developing a chemical that may have toxicities. We're trying to adapt their immune system to recognize their cancer as foreign. So the example I gave you, cells are taken outside of the body and engineered and expanded and given back. That's a form of adoptive cell therapy. Cancer vaccines are different. We're trying to educate the immune cells in your body to recognize something unique about your cancer. And so cancer vaccines are that form of immunotherapy. And Celloram is right in the mix in developing new forms of vaccines. Again, very personalized therapies. They're based on understanding the genetic differences between someone's cancer and their normal cells, and then exploiting those differences to educate their immune system to recognize their cancer as different.